panel, paying for long-term care and why we should all be addressing it in the work that we're doing. So this was my selfish plug in the Care Colloquium to make sure that we talked about finances, because I built it around that. And then I have put some brilliant lines that all hold a piece of the puzzle of paying for long-term care. So Amy is going to moderate us, which I also thought was extremely appropriate, and she can make sure that we are answering as deeply as we need to be answering. And we will all introduce ourselves before talking, and we are diving deep into our work as well as answering the questions, and we will need time for questions from you that you can address to either the whole panel or to one person. Okay?
Yeah, do I need a microphone?
No, just.
Okay, so welcome everyone. Good morning, everybody. So our first question is, what do you think is the hardest financial challenge for families dealing with elder care, and how do you try to help? So who wants to start? Kimberly, wait.
Hello, my name is Kimberly Whiter. I am the owner and CEO of Elder Care Solutions, and we are on a mission to ensure that caring and aging are not experiences that financially break families. I think the hardest thing about finances with families that are in caring and aging situations is that there is no magic answer, and they often are looking for one. One is also really hard to admit money or to pay for all the care that just feel is what needs right now. So starting a conversation can be very difficult inside and outside the family, and then once you do have that conversation, they are often looking really deeply for just these magic answers. Okay, I've asked for help, where's the answers? And they are connected. They exist in professional silos. We are not working together very well, and it's really tough to just navigate. And so that's where we can hard to help them navigate this pain of care.
Yeah, just go on down. Okay.
I'm Huddleston. I'm Director of Education and Content at a company called Carefull. It's a digital platform that was originally built for financial caregivers to make the job of managing your loved one's daily finances easier. I was a caregiver for my mom for 13 years, and she was in memory care those years. We spent more than $500,000 on care, and she did not have long-term care insurance. We had a conversation about it before she was diagnosed with Alzheimer's. She couldn't get it because of a pre-existing condition. I am so fortunate. My mother had the financial resources to pay for care. And then part of it was because she was a good steward of her money, and I have to give myself some credit for managing what resources she had pretty well. And so we were able to afford that care. But, you know, we all know a lot of people can't. And that's why there are family caregivers, because people cannot afford the high cost of care, and people go bankrupt over it. People use all of their savings. People have to step out of work to care for loved ones, and then that just perpetuates the cycle. Then their children have to take care of them, and it just goes on and on and on. And like Kimberly said, there's not a good solution. I certainly think that it starts with conversations and admitting that there is a very likely chance that we will need long-term care as we age, and so we need to plan for it. We can't just hope for the best. We have to plan the worst. It has to be part of our financial planning. What Carefull does in particular, though, is it aims to make the job of a financial caregiver easier. If you are having to manage someone else's money, we can't help you pay for the care, but we can make it easier for you when you are caring for a loved one. Stay on top of their finances, helping you catch those unusual transactions so that mom doesn't lose all her money to a scammer and now there's no more money to pay for care. Making sure that there aren't mistakes and the bills are, making sure the bills are getting paid, because we're going to alert you if the bills are late and they're not getting paid, so that you can make sure they are paid and the lights stay on, or the policy premium is paid, so that that policy is there for you. So that is our goal, is to make that side of caregiving easier, make it easier to stay on top of your loved one's finances, anyway. Any way that you can provide some help for caregivers is, I think, a good thing.
My name is Gretchen Beedle, and I'm a financial advisor here in Roanoke, Virginia. When Cameron and I first met, one of her first questions was, do you talk to your clients about long-term care? And the answer to that is absolutely yes. But not everyone is willing to devote the resources early on that are going to provide them with the coverage that they need. In fact, what I was sharing is that for many folks, they're beyond to the point where they can actually qualify to get long-term care coverage. Younger folks, now that there are hybrid products available that can combine either insurance and long-term care as a component of it, are jumping on this opportunity because at their age, the cost can be very small. But we still have a gap where you start talking to people who are in their late 40s to early 60s, while they can still qualify for long-term care coverage, but are not willing to put the resources towards that because of a variety of other priorities they might have in front of them. And having those conversations and how difficult it can be, because if you don't plan for it, is absolutely when it's going to hit you.
Morning, everyone. I am Canterbury. I'm a pharmacist by trade based out of North Durham, and I'm the founder of GeriatRx. We focus on de-prescribing specifically, but in my line of work, I actually volunteered as a state health insurance program, so a coordinator. Basically, these people are trained to have objective information to help explore Medicare, Medicaid benefits, if you can qualify for disability, etc. And I'd say one piece of this puzzle is seeing how we can really talk about all the benefits. There are resources out there that I feel aren't going to be known upfront, right? And so as an advocate, as a pharmacist, you kind of have to get used to finding, all right, what can we make the cheapest possible option for you? Knowing what meds to look at, that maybe even too much, One case we've had in helping with finances, and this is maybe a tangent, but knowing that some of your patients, for instance, this patient had Parkinson's, expensive brand name drug, trying to work on how to reduce costs for them. And one way we could save their out of pocket was getting this person in a clinical trial so that the drug, which was a brand name only Parkinson's drug, became covered. And what was a usual $120 copay ended up being about a $2,000 savings in a year for a family on a fixed income. So I think, again, I'm speaking to the role of looking for the nerdy, little dirty secrets that are out there and navigating that system. So at least now you have more in pocket that you can use to afford for these long-term cares, which we know are unnecessarily costly. So I think there's versatility in just knowing what benefits are out there, even though it may seem slim to not.
Good morning. My name's Lynn Atkinson, and I'm also local in Roanoke. I am an insurance broker, and I work mostly in the Medicare market, although I do have some long-term care clients and certify in long-term care every year to keep that up to date. It's tremendously expensive. It's hard to get. Not everybody's going to buy a long-term care insurance product. It's just not going to happen. I'm seeing people when they're already on Medicare. So for the most part, they're already 65 years old. Sometimes they're younger and they're disabled. So they're not the market that is going to buy a long-term care policy for the most part. So I agree with the gentleman about finding resources. There's resources for pharmaceutical assistance. If someone is a veteran, if someone works for the federal government, anybody have a family member that works for the federal government? The federal government has long-term care insurance available to employees that you can buy while you're working. A lot of federal employees don't do it, but they should. Some companies, not many, but there are some companies out there, and if you're a broker selling small groups or even large groups, it can be a tremendous tax break for a company to offer long-term care insurance to their employees. So you can get those kind of things going when someone's younger, But once someone's on Medicare, Medicare is not a long-term care insurance product. It's never intended to cover long-term custodial care. It's going to cover a medical rehab, very short-term, and only if you're meeting certain guidelines. So that's generally when I'm seeing people, and that's when the conversations get a whole lot tougher. And you start looking for those resources through the SHIP office, which here locally is Local Office on Aging. The Carefull Medical Center here in Roanoke has a, it's called the, I'm drawing a blank.
Center for
Healthy Aging. Thank you. Thank you. Center for Healthy Aging, which is a tremendous resource base that I refer people to all the time. So kind of have to know your area and know your population and kind of know where to send and look for things too.
My name is Covington. I'm with Patriot Angels. We are outside of Asheville, Tennessee. What we do is we help veterans and spouses navigate the VA system. It's a pretty difficult system to do on your own. Some people can have great experiences, but most don't. We help them apply for the age and attendance benefit specifically, which I'm sure a lot of you know of it. That goes a long way to help pay for care. Doesn't cover all of it, right? But it goes a long way. So we've actually helped over 14,000 families get approved for those benefits. I think that's like $500 million at this point. And so that's what we're doing on our end. A lot of people don't know about the benefit, and I think it's easy to market to senior living communities, but we kind of get the word out to, family caregivers, right, that aren't going to tour a senior living community and get a brochure. So that's what we're here to know today. But yeah, so that's the kind of the issue that we see is this is a very underutilized pension. But that's the resource that we can provide families as far as helping a little bit in covering the cost of very expensive care.
The Veterans Day and attendance benefits were a huge help for our family. It would have been even worse without that. And I certainly talk about it far and wide, because you're right, reaching people is part of the problem. I'm curious, two of you mentioned the SHIP program. Is there anybody who doesn't know what that is? If you know anybody who hasn't heard of it? That's nice to hear. It's not nice that you don't know, but it's nice to hear that most of you do, just because it is another one of those programs that people don't know about. And it's the state health insurance program, or state health assistance programs, I think technically. And they just help you figure out especially your Medicare decision. Some of them can help a little bit with Medicaid also, but every year when you get the re-enrollment and open enrollment, all that stuff, it's completely overwhelming. And they're incredibly well trained and can be really helpful and help save a lot of money for people. So I just wanted to emphasize that. So, okay, so our next question is, why do you think so many families face financial strain and crisis and, like my family did when they need long-term care? And some of you kind of touched on this. Gretchen, I'm going to ask you to start, because you kind of started talking about this reluctance to do certain things and save when you're younger. Say more about that. Why people have financial strain?
So a couple of things can oftentimes happen, and not the least of which, and I see this not just in a long-term care issue, but oftentimes when anyone runs into financial difficulties, one of the first things that they try to go to is their retirement accounts. And if someone is the child caregiver, meaning that you might be an adult, but you are not the one who's needing the care, your retirement accounts are protected in a variety of ways that other assets aren't. But if that's the first place you go to, oftentimes the easiest, right? No one's going to ask you any questions, and you can just pull from it regardless of the penalties or the taxes that are incurred in doing that. You've opened yourself up to a greater wealth of financial problems, because not only have you borrowed or taken out your own future, you've now eliminated a level of protection, creditor protection, that you would otherwise have. And I think what happens is we get really sensitive and embarrassed about money. Right? We are not a culture that likes to talk about it. And so we go to things that make the most sense to us because it's accessible and it's easy. without actually speaking to a coach or a financial guide to help us look for what those other options would have been first and foremost. Now, I am speaking to the choir in here. You guys know this inside and out better than anyone, but that's the natural reaction for someone who is not aware of what's going on. And completely frank, probably 50% of my clients are going to call me before they're going to make a major financial decision, but 50% of them call me after they've already done it. And so that's the importance of having a financial coach that you trust and can speak to, so that you're talking to them to learn about those things or be referred to any number of you for the resources that you can bring. And it's a lack of awareness and I think a level of our cultural embarrassment around money. That's one of the biggest problems.
You know, that's such a good point. And I don't know if you were here yesterday, but I went through bankruptcy after caring for my parents for about 12 years and other people at the same time. But that was the mistake I made. I had a financial advisor for my parents' money, but not for mine. And I did not make this mistake of going into my 401k or my pension fund. So that's the one good thing I did. But you're right that you're speaking to the choir, but that we in the stress of caregiving for someone we love and will do anything to make their life better, that we don't make some poor decisions along the way.
Well, it's all about your priorities, right? Your priority, the people you love over yourself, right? And that's what it means to be a caregiver. And so that's the hardship. So it's how we raise our own hands to ask for the help and guidance.
Yeah.
And so much of it is about being more open to talk about this. So
Exactly. Yeah.
I'm so sorry, I was
No,
just
no.
silly.
I think why families are struggling is because they are reacting to a system that is set up to pretty much put them in a position to fail. So I spend a lot of time asking, like, why is this so stupidly expensive? Why is it breaking families? And there is a perfect storm brewing out there. So one is the baby boomers. We all have been messaged our whole lives that they're a giant generation, the biggest we've ever seen. We know that very well. But what we don't think about is some of the other things that make them incredibly unique. They are the first generation to go their entire life with modern medicine, which means the way they age, it has changed the game. We now age completely differently because we've had modern medicine in our lives since the day we were born. So actually, the baby boomers have gained 2 decades of life over the generation right before them. So in one generation, we are now living 20 more years. What's going to happen to the Gen Xers? So we have a giant generation that's living a lot longer, and their aging is chronic conditions that are pretty well managed. So what they need help with is not skilled nursing level help until the very end. They need help getting around the house, making sure they have medications, getting to and from places that are important for them to get to, making sure they're eating healthy. That's not medical care, that's long-term care. And we have to be careful that when we say long-term care, we instantly don't think about insurance. We're talking about care here. And medical care is what Medicare was set to do. We are coming around on that was set up nearly 100 years ago, and it has not changed at all. And we don't need medical care. For a lot of loved ones, we need long-term care, and Medicare has not expanded to include any of that. So when we need personal care, home health, assisted living, independent living, and memory care, Medicare is like, not us. So what are the families supposed to do? They have a loved one who is a part of this giant generation that's putting stress on all the systems out there that is going to live for a very, very long time with some conditions they need help with for a very, very long time. And they have a governmental system that is not supporting them at all. And that's the storm that's brewing out there, and we're not doing anything to fix it, right?
I would just add on top of that, we have buried our heads in the sand. We've been planning, because guess what? We're never going to get old, and we're never going to die. We don't have to worry about it. It's not going to happen to us, but it does. And the thing is, like, as a journalist, I see and read a lot of surveys. People aren't even planning for long-term care. Only like 11% of adults have long-term care insurance. Most people don't think of it as a priority. I mean, of course, they're prioritizing their retirement savings, which is important. But if you don't make long-term care costs part of that equation, then your retirement savings can be quickly wiped out. You know, and I mentioned that my mother's care, it cost more than $500,000. Most people don't even have that much money saved for retirement. And so we're just pretending that it's not going to happen. It's not going to happen to us. It's not going to happen to our parents. And what's even crazier is that people who have been in that caregiving role and they know how much it costs, they're not planning either. Some of them are. Some of them have had that wake up call and they're like, oh my gosh, I have to do something to protect myself for the fact that this is happening. But a lot of us are just still like crossing our fingers and saying, okay, I'm walking every day and I'm eating well and my mom was in good health. But that had nothing to do with the fact that, I mean, she was in great health, but because she was diagnosed with Alzheimer's at 65, she had it for a really long time because there weren't other health issues, you know, that shortened her life. And so got to wake up and realize that there's a really good chance that it's going to happen to us.
Yeah, well, you have to know I do have a financial plan. Why don't you pass the, I guess you have microphone. Somebody had started to say something.
Oh, I was just gonna comment on Kimberly's remark about Medicare being prepared for this. Medicare is not really ever going to be prepared for this. They made some little motions with the Affordable Care Act of trying to add a nationwide program for long-term care, and they never could get the financing, you know, to work. One thing though that I see, and I've been in business for a long, long time, but I do a lot of Medicare Advantage. And if you don't know what Medicare Advantage programs are, they are the privatization of private insurance companies. Those programs have a lot of not skilled care, at-home benefits that they're building into these programs that are much more case management driven. These insurance companies have social workers, they have case managers, nurses, that if you know how to understand your benefits, you can receive some care in your home or things that will keep you in your home with transportation, with meal delivery, with some personal care. Many of the plans have some of these benefits available now, but you've got to know where to look for them and how to ask for them, which hopefully is where someone like myself comes in, because I do understand the benefits. I have channels to get you in touch with the people that you need to get in touch with. So I do think that that's something that, again, the money that's flowing into these programs is coming out of all of our pockets here because that's how it's paid for, through Medicare taxes and Medicare premiums. But because it's gotten so competitive, all these insurance companies are trying to do more and more of this in a lot of ways.
Yeah, Molly, you know, you focus on veterans. Why do you think that families and caregivers of veterans end up in a financial strain? And
well, there's a lot of untapped resources with veterans. I love veterans. They're so humble. That's what's great about them. And a lot of them don't even look for benefits for themselves, right? It's usually, you know, Patriot Angels, it's usually the daughter or the son that's calling in for them. I just told the story last night. You know, we have a family member call in. We just don't feel bad I'm calling, because you know they don't want to see anything from the VA. They really don't. So it's the, you know, on the family to look and try to see, you know, what happens with them that they haven't even looked into their whole lives. So yeah, a lot of families just haven't started looking until it's kind of too late, right? But yeah.
There's also, and I've talked to Suzette, CEO of Patriot Angels, about this too. A lot of our agents that are veterans right now are Vietnam vets, and they were so discriminated against as with their veteran status that they have a preconception that they don't get the benefits.
Yeah.
And so we have to re-educate that that's not the case anymore, and it's based on dates, not what conflict you were involved in. So sometimes they're messaging to their children, oh, I don't get veteran benefits, don't look at it.
Yeah.
Because they don't, but they do qualify. So we have to be educated around that.
Well, I hear from a lot of veterans too. Well, you know, I didn't have as bad as some of these other guys. They let them get it. They can get theirs too. So, DeLon, what would you add about why families end up in financial crisis?
It's just becoming more expensive to be in there, just period, all around.
And
Just all around the world. I mean, produce, right? Access, like staffing in these facilities. And so.
Use your microphone.
Oh, yeah, sorry. So, I mean, apart from just life in general, but the cost of living is going up, housing is going up. We're in an elder housing crisis right now. I mean, there are tons of reasons, but I think to Mally's point, the personality of the vets are humble, and it does fall on a caregiver to find access and that support for them. And then we're talking about just general disparities. Even the Black or Latino veteran, they don't always feel welcome. And so they may not even know what's out there for them. So despite disparities alone, the living here is tough. And I actually have my own concerns about where am I going to retire, because there are less care providers. But that's why we have consortiums like this to try to brainstorm and work around. But life is hard. And I think sometimes you need to have some grace for everyone. We're all going through something.
A lot of strain in general. Gretchen?
There's also one more point I want to make that relates to some of the work that I do with my clients, and that is the protection for the remaining spouse. Right? Because we've been talking about caregivers in a variety of ways, but not the least of which, given the cost of caregiving, is ensuring that there are still resources for the remaining spouse and what that looks like, and how early you have to start preparing for that component of it as well. There are steps that you can take, but if you don't do it in the right time frame, you've created an even bigger financial burden. And so that's just one more area that we all have to discuss in order to make sure that everybody is looked at.
So I want to ask each of you, what is the first thing you would tell a family who comes to you and says, I'm having financial challenges, or I'm in crisis, I'm in this middle of caregiving situation, what can I do? Like, and let's look at it as like they're in it, not planning, because we all plan and we know that, but sometimes we don't. So what's the first step, and what are 2 or 3 things that you would have them do? Can you start? Mix it up here. Yeah.
Like, you don't go and try to do surgery on yourself. You don't, try to get your own braces on or pull your own teeth or cavities built or whatever. We are not, we don't, we're not educated to be doctors. I mean, a lot of us don't even cut our own hair. We go to a professional to do it for us. But when it comes to money, we don't go get professional help. And we're not taught in school basic personal finance. And so there are lots of professionals out there. There are companies, Medicare Solutions, there's Patriot Angels, there's someone who can help you, make sure you're getting the best deal on your prescriptions. There's someone who can help you create a financial plan and find those resources. There's someone who can tell you what Medicare Advantage policy is going to be best for you and help you save money. There are lots of professionals out there. And so take advantage of those professionals. And a lot of times people think, well, I can't afford it. I can't afford to get a financial advisor. I can't afford to get an attorney. Well, there are wonderful people out there who will do pro bono work. And so you just start asking around. I think that's where you start, is you get professional, because you're not an expert. But there are experts out there who can help you.
yeah, sure. Well, if they came to a good spot. But say, find someone who knows a lot about a lot of things. That's my answer. And so there are some key professionals that know a lot about a lot of things. And so if you can find them and tap into them, you're going to be put on the right path and take that through yourself. My work specifically has tried to pull, I built friends in places that have all the answers, and I can help you navigate that. But if you don't find something like me, I have two key professionals, right? A financial advisor, because of the way that they function, they are like, here's all the stuff I can tell you about finances, your retirement accounts, your investment accounts, the smart way to pull money in, when it's smart to tap into it, and when it's good to not touch it. And then when you have all the other questions, they already have friends that are tax professionals and attorneys and everything else, and they will refer you out. And often you can get your first consultation for free, and then you're gonna get sold into working with them because you're gonna see how much they know. My other who knows a lot about a lot of things and are very good networkers are elder law attorneys. They do the same kind of thing. Specifically, elder law attorneys can help you with Medicare, Medicaid, and veteran benefits. Some of them specialize in the different pieces, but even if they don't, they are well networked with people who can help you navigate that. When people just say get on Medicaid or even pick out the right Medicare plan, that's a hugely bureaucratic system that you are not set up to navigate. You need a professional like Lynn who can say, let's pick the best policy so your premiums match what's getting covered. Because you can waste a ton of money having the wrong policy for what care actually looks like. So people who know a lot about a lot of things is gonna help you tremendously.
Yeah. So Mom, what would be the first thing you would say to families?
Well, in my road, we talk about trucks a good bit, so I might go down that road, but sure.
You got it.
Yeah, so really for me, I like to explore what are all available federally and state in terms of state assisted funding programs. And they literally have funds based on the drug that a patient may be on to figure out, okay, you may qualify if you hit this federal poverty level and get some support you need. They do have grants, so some states are proactive. They have nonprofit pharmacies, there are models where they have just strongly pharmacies, no insurance is billed. And there are even, of course, discount coupon costs you can use, like GeriatRx, and plenty of others that are out there that you can check out. But I think it's smart to kind of doctor shop a little bit when it comes to pricing on medications. And that's one of the hurdles I see most is, how can I get this cheaper? Or if I hit the gap, how can I prepare for this? There are even manufacturers that provide coupons for people, again, like that are brand name for free, and they'll set you up. And that was something we've had to do, again, working in the SHIT sites. You have to get really savvy in navigating some of those costs. I also want to highlight the importance of foundations like PANF foundations or patient advocate. They have navigator foundations that frequently just make millions of dollars to give away to people who need their one's based solely for cancer, there's some for dementias, and I have the pleasure of meeting a good bit of them at a couple of conferences ago. But they're looking for community partners. So I really stress relationships, as Kim was saying, having those strategic partners in place who can navigate the game for you. And what Amy said yesterday, build your team. That's the first thing you have to do is build your team. From the housekeeper to the financial expert, you have a task force up here that can absolutely handle those for you. So I also will say to leverage your pharmacist, at least when it comes to meds and your benefits and understanding what else can be out there for you.
Well said. Yeah, I've just recently been doing some work with the Healthwell Foundation. I don't know if you're familiar with that. Yeah, I didn't even realize that some of those foundations existed. So most people don't know. Yeah.
Totally agree with everything he said from the physical side. I talk to people about drugs a lot. And all day, my services are free. I get paid by insurance companies, so it doesn't cost anything to talk. But on the pharmaceutical side, there are so many programs out there. I'll tell a client, if you're going to pick something up new, ask them what's the cash price, what's the good RX price, and what's the price with insurance. If it's hugely expensive, then that's when I'm going to put that case management tool in place with whatever insurance company it is, because that's what those caseworkers do. They can find the pharmaceutical assistants, they'll walk the person through it, they'll help them with the forms. Some doctors' offices have that. Again, Carefull Clinic here in Roanoke has a program that will help people find help on pharmaceutical costs. So all of those things are out there, but you've just got to know where to look. And like Kimberly said, you've got to have that that serve of people that you can refer to. I have a number of elder law attorneys that I have sent people to, CPAs for those kinds of things. Like Kimberly said earlier, these silos, you can ask your CPA tax questions, but they're not gonna give you financial advice. Your financial advisor isn't gonna tell you anything about your taxes, and, you know, you get into that, and the lawyer's not gonna talk about either one of them, so.
Right. So the more that we all know about what everybody else does and refer, you know, from our, more the better.
Right.
That's pretty obvious.
Yeah.
We would ask, are you a veteran or a spouse? That would be the first question we would ask somebody that would come to us for help. So in senior living, as far as senior living residents, for aspect, anywhere from 30 to 50% residents are veterans or spouses. Less than 2% of them are getting their benefits. That's crazy. There's no telling what that is in, you know, family caregiving aspect. But that's what we do know is in senior living residents. So there's so many people out there that we haven't even touched. So that's kind of what I would ask. Are you a veteran or a spouse? If so, let me tell you what we do.
Yeah, exactly.
So we don't know what we don't know.
Yeah.
Exactly.
And you don't know what questions to ask.
That's a question. Absolutely. Yeah. You said my dad was a veteran, but he never availed himself of any of his veteran benefits. I was the one who got, oh, needs hearing aids. I'm going to enroll him in VA healthcare and that's what we attended. So it is often up to the care. So what do you all want all of us, all of your peers who are leaders in this field to know about the financial aspects? We've already said, educate yourself so you can refer out, you know, for the what you don't do. That I think is a first really important point. What else would you tell them, Kimberly?
I would say, like, finances are going to come up. I think it's a given that that is a stressor for families. So many of you are in positions where you're having conversations very deeply with family caregivers. Bring that conversation up, say, and is finances a challenge for you too? And open that door, because once you do, I think you'll recognize that's a big stressor. And then say, let's start looking for some solutions there as well. But let's not be shy to have the conversation, because we often feel like that they might bring up a challenge that we can't overcome and we maybe don't want to touch it. Let's start looking, you don't have to have all the answers. You just have to know the people that have them, right?
You can go ahead if you want. I'm still trying to think of. I mean, obviously, I spend all of my time talking about finances with people. And we run, whenever I do a fee-only financial plan, the what ifs of premature death, of a long-term care need, of a recession, right? We take all of those things into account. And the fact of the matter is, money is a finite resource. And so trying to figure out how to prioritize and allowing people to be aware of the decisions that they can make so that they are consciously making those decisions, right? That's, I think, one of the hardest things is that if we had all the money in the world, one, we probably wouldn't need long-term care insurance because we could afford to pay it directly, but two, we would do everything that we're supposed to do. But there's not enough to go around, as Mom was just commented on, but I think we can all feel and how hard that can be. So it really comes down to having those conversations, Amy, as you had just mentioned, creating that network of referral sources so that you can ping on someone else's expertise. And then most importantly, being open about these things with others so that we treat it with less of a private, closed off, it's my problem, I'll just take care of it attitude. Because I think if you sat down and shared with the world some of the things that you have to deal with, you would realize how much support and resources are out there. But we take such a individualized, and this is part of our country's personality of it's all on me and I've got to make that happen. And it's not, we are a community and we're here for each other. And the more we can be expressive about that, the more it opens up the ability for others to be expressive about that too.
Very well said.
We're all here to care for each other. So I think leading with that perspective of empathy and understanding, and that this is an ongoing journey, is going to be really the groundbreaking steps to take to start having talks about this money finances. But I believe you have to be upfront about it and just talk about the elephant in the room a bit. So I appreciate leaving the door open. I think that's Kimberly mentioned. So really, I want people to explore what they can do, of course, medication-wise. I always tell patients to question the further invoice you get from a hospital. Dispute it if you can. If your meds cost too much, drugs. Ask for a tier step down authorization if you're on a brand name drug. This is a thing that insurers can do for patients if it's medically necessary. Just think about what it is. We talked about even using the HSA cards, flex cards, if you have that type of plan set up with your job for payments. I think there are a couple of loopholes. It's just, again, having people to talk and ask and no, if you don't know, real leverage. So I have plenty of thoughts. So
Yeah, I think it's just people to talk. Many times I'll go into a situation where I can tell something's going on with one of the other people, where someone's memory's starting to fail or issues are coming up, or they'll mention something. And I can't really do much about that to make anything happen, but I'll start telling them resources that I know, like the LOA or Carefull Center on Aging. Just make little recommendations and hopefully they'll follow up on them. But it is hard to get people to talk. I just recently attended a palliative care conference. Well, it's just a one-night event over here in Roanoke that the Carefull put on with their palliative care. And just having the conversation, people don't want to talk about end-of-life decisions. And at the end of life is not when you want to be. You want to have the conversation ahead of time. And the same with financing long-term care, or just finance, how you're going to handle aging in place, what you're going to do. You just need conversation with whoever it is that's going to be involved in that kind of care.
As far as what I say to everyone here, as far as kind of what to lead with, I think we should all do our best to lead with kind of a plan, to bring back to, the families that you work with, as far as building our team. Maybe we can build a networking team, right? That, run across issues. If people struggle with the cost of, prescriptions and things like that, great. I just found somebody, right? Let's leave with kind of a little network in our little team and collaborate, I think, is kind of the goal of this conference. I think that's what we can do. I think there's so many resources that we've needed, and then we're going to assemble somebody here that can provide those. So that's what I'm going to do when I leave here, as far as working with all of you.
Nice, yeah. Cameron, did you want to add something?
Yeah, so I can think about it. I think hopefully everyone in here will use whatever platform they have to educate people on the cost of care. It's not a sexy topic. I mean, when you're on Instagram, you'd much rather look at whatever, home interiors or whatever, someone doing a cute TikTok dance or something like that. I'm on there and I'm talking about it and hear about it. But the more we start shouting it and making people listen, then maybe some people will take notice. And, even if you're reaching a few people and you get through to them and they're planning, you've made some progress, you've helped some people. So anyone who is in a position to share with an audience that this is going to happen, it's going to happen to you, it's going to happen to someone in your family, you've got to have a plan and helping people figure out where they can go to get help in making a plan. So
yeah, I like that even if your thing isn't finances, if you're interacting with caregivers, you got to introduce them to the topic and encourage them on. So I want to open it up to questions. Who has a question? Go ahead.
Okay. I'm Michelle from Carefull Advice, and I actually just had a scary-ish thought while I was sitting here that I haven't thought about before, which is my daughter has special needs, and she's our only child, so she will not probably be able to care for us. So of course I've thought about we have to care for her for a long time. And what that looks like and how to pay for that and just, you know, but I just realized like in addition to making decisions for her and setting things in place for her future, if something happens to us, you know, what if we need care and she has to be in charge of providing it? So, but I think there's just a lot of layers, and it's not just elder care. I mean, long-term care gets associated with elder care and senior living, but there's cancer, adult cancer, and our family's affected. We're still paying for my cancer, and so the other thought I had too is, and I talked about it in another discussion yesterday, is getting to the person next to the caregiver, because the caregiver is so overwhelmed. Like I know there were programs and foundations for helping me pay for my cancer treatment, but I was not only going through the treatment, but still caring for my daughter. And I just couldn't like get my arms around another application. But if I had had somebody I could say like, please take this and run with it, that would have been amazing. So I think sometimes some of us know what the resources are. I mean, everybody in the room knows what the resources are. It's like, for me anyway, finding the time to sit down and do the plan of work. It's complicated, and finance is not your language, which is not mine. I just like keep procrastinating on it. So I think it's important to not just target the caregiver, but the person, the family, the person in the family that's good with finances. Like my brother-in-law helped his mom buy a car through Carefull, and he lives in California and she lives in Pennsylvania. And it was so great. Like he handled that because I'm the on-call person for my mother-in-law too for stuff. So there's ways, especially now so much being digital, that another person in the family, not the primary administrator, can be involved and take this project and run with it.
It's such a good point, because that's something, you know, the kind of thing that, okay, how can I help? Well, you can do research for me. You can find that one of you. You can find that person, or you can
Track down the foundations.
The caregiver has to be willing to let somebody in to the finances. Any other reactions to what?
I don't know your specific situation, but you just mentioned the special needs child and that you had cancer. So one of the best ways to try to provide for your child, knowing that they will likely outlive you, is life insurance. You've had cancer, you probably can't get life insurance. So let me just say this. Good. If someone finds themselves in that situation, if they're married, you can do something called a survivorship policy, which is on both parties in a marriage, but only one has to be insurable, and it doesn't pay until both people in that marriage have passed away, which then becomes the funding resource for the next generation or for whatever the needs might be. So I'm just saying that in case you guys were not already aware of that, that can be a phenomenal tool for someone in a situation like yours if you didn't already have that in place, to make sure that your child could also be taken care of regardless of who might be the last to pass.
I also say that you're overwhelmed. So I think all of us, when we're helping family caregivers, like we can say, oh my God, I found 5 things for you. And they're gonna be like, I'm gonna X out of that because that seems like a lot. Like they just can't do it all, right? So I work really hard. I said, we're gonna take it one solution at a time. And I'll say, okay, solution number 1, here's what I'm gonna do, and here's what you're gonna do. And so I'm gonna go hunt these down. I'm gonna look for an application. You just sit and wait, and I will deliver the application to you, but you're gonna have to fill it out because I can't do it for you. We take it step 1, and then we move to step 2. So anything you can do to granular as much as possible, to just say, here's one thing we're going to do, and then we're going to move to this thing, but we're building your solutions slowly so it's not overwhelming for you, helps so much for family caregivers who are doing 25,000 things a day. Right.
Or make it easy / give me a checklist. You give me the checklist, I can do it.
Right. Go ahead.
2 kind of questions and comments. I have been caring for my husband for 10 years with his diagnosis. we had his diagnosis, we had looked at long-term care, and our financial advisor said, well, your portfolio will sustain. Your portfolio, it's better for you to just have your portfolio and your investments rather than investing in long-term care and all of that. And we're like, okay. He takes very good care of us now because Jack has way outlived any of their programs. So part of I think the conversation, and I would like to hear if you guys recommend that or not. I don't think that's a legitimate conversation that should be had. And I've talked to a number of financial advisors who still do have that kind of an advice. That I'll say as a comment from learning of this is that I had to learn something on my own, which was I had to choose to separate my finances from my husband's. In the beginning and all through it, we were doing things together. So I'm looking at our finances based on his care and not knowing when the end of it will be. And I am not looking at what's protecting me long-term. And the conversations didn't come up about that. And one day I said, and it's a hard conversation to have with yourself. It's like, okay, then you like, okay, I can feel guilty about this. Well, guilt's not a wasted emotion, so we don't do that. So very hard. And I feel like a lot of people I've talked with, they've never thought about that. And then when they start to thinking about it, they're like, oh, well, this is awful. And I don't know if you as financial advisors or wherever you are in your advising, are you advising people who are a couple to separate and to look at their long-term plans differently?
I feel like Gretchen has she's holding.
She's got the
I say the surviving spouse needs to start looking ahead very strategically.
And that goes back into a level of kind of elder and estate planning where we'll oftentimes work with attorneys who specialize in that area in order to do exactly what you just described, which is protect assets for the surviving spouse. Because otherwise you could be left destitute with decades in front of you, all in the mode of trying to do the best for the person that you love.
Right.
And so, do I do that? Yes. Does every financial advisor do that? No. And I'm honestly a little surprised that your financial advisor told you not to get long-term care insurance. However,
12 years ago. So he has promised. He said, I don't do that anymore. You guys have taught me not to do that anymore.
That's the landscape.
and the landscape has
Changed
changed
a lot in the last few years.
the cost of it, the amount of time that people oftentimes spend. Yeah, and there has been kind of that resistance of, well, I don't want to pay for this because I might not use it. Just like every time you pay your car insurance, you go, oh, crap, I didn't crash my car this time.
Well, also to be
Yeah.
traditional policies, the coverage was not great.
Right.
So you were paying into something for a very long time. And then when you were in a space where you felt like you could start pulling the benefits, they were like, oh, we don't cover that. And you're like, oh my God, I just spent so many years. They are now much more comprehensive.
They are much more
They've
comprehensive.
changed a lot. They kind of like went away and they're like, okay, we don't do long-term care insurance anymore. And then they came back better. So that's, we have to re-educate on what it looks like now too.
Well, and 14 years ago, there was a dominant force in the long-term care coverage industry, Genworth. They essentially went over and had to be bought out of receivership, and every other provider at that time is pretty much not offering long-term care coverage any longer, and a new batch have come along who are charging more and that are also providing greater benefits. What most importantly, starting in the home and speeding up the access to those benefits if you start in the home.
You know, that spouse issue though is important because I was just thinking one of the big mistakes people make when it comes to long-term care, and if they do kind of any sort of planning, is their plan is they're married, my spouse is going to take care of me. I am married, my spouse will take care of me. I don't have to worry about it because that's what spouses do. But the thing is, if you're in your late 80s, how is the wife who is 88 years old going to get her 90-year-old husband up and down the stairs? How is she going to get him in and out of the bathroom? How is she going to dress? She doesn't have the physical or emotional strength to do it. You know, and I tell people this all the time. Your family cannot be your long-term care plan. They can be there to help support you, make sure the bills get paid. But there's gotta be money there to pay for professional care because there's no guarantee that your spouse will be alive, that your spouse, if your spouse is alive, can do it, that your kids want to take care of you. They might hate your guts. And they're like, whatever, mom, you are on your own. And they live, and that's okay.
Yeah, sometimes it's not even that they hate your guts, it's just that
They can't be because they're own kids.
disability or, yeah, exactly. We have time for